Hello there, and welcome to a new EPSA project, the EPSA Podcast. My name is Leonor, and I'm the EPSA Publications Coordinator, and I hope to become a frequent company for you and your daily life. To launch this amazing project, I count with the amazing contributions of the representatives of EPSA, the European Association representing pharmacy students, ENSA, representing nursing students, EMSA, representing medicine students, EFPSA, representing psychology students, and finally EHSAA, representing dental medicine students. And we'll talk about interprofessional collaboration and ESAS, or nowadays known as ESA, the European Healthcare Students Associations Alliance. So without further ado, let us begin. Okay, hello everyone. Thank you, Luca, also for being with us today. First of all, please introduce yourself and also your association, please.
Hi, sure. Thank you for having me. So I'm Luca. I'm a recently graduated medical doctor from Croatia, and I'm the Vice President of External Affairs of the European Medical Students Association, EMSA. EMSA is basically an umbrella organization for representing medical students in the European region. We're a faculty member organization based, so any medical faculty can establish what we call an FMO, so a faculty member organization. And then by becoming a member, they can get involved in all the activities that we hold as medical students in Europe.
Okay, wonderful. Such a great concept. Okay, now please, in your words, how would you describe ESAS?
Oh, EHSAA, I would say, is a platform, a network for all healthcare students to come jointly in one place and try to detect areas of overlap and areas that we would jointly want to take positions on or initiate projects on, and then, talk together and try to make them happen.
Awesome, amazing concept. So, currently, what is your association working on to include interprofessional education and collaboration? What's your opinion on that?
Well, actually, interprofessional collaboration is one of the segments of our mission in our organization.
Yes.
So it's something that we very strongly believe in, and actually, EHSAS is the main platform that we're involved in to promote interprofessional education and collaborative practice. So all our initiatives where we see we could tackle interprofessional collaboration are proposed to EHSAS members within the alliance, within the network, and then we try to seek interested people from every organization to, join us in those initiatives.
So ESAS is also a platform to achieve this goal.
Definitely, yeah.
Okay, amazing. And now that we touched our students and everything, our curricula as European students in healthcare, it's totally different for sure. But what do you think there are the similarities that help us to get to this interprofessional collaboration?
So honestly, I don't think in either of our professions' curricula interprofessional collaboration is established enough or tackled enough within the subjects that we have. The clear advantage of that would be letting future healthcare professionals know for which issues you should approach which healthcare professional in order to achieve the best outcomes for patients,
Yes.
Because
I totally understand.
if the educators don't point that out to us, and if we're not part of these types of alliances, it can become it doesn't become second nature, and it should become second nature that for certain issues you know to which professional you should talk to and approach in order to, as I said, achieve the best outcomes and to form more comprehensive treatment plans for patients.
Yes.
And not only for patients but for the healthcare sector in general. Just having everyone at the same table providing their input brings about a lot of potential benefits in developing the healthcare sector. So
definitely. In my personal opinion, I think that's also an issue that still needs to be tackled. And I think ESAS, as you were saying, is also an amazing platform for us to start advocating for that. Sure. And with that said, what do you think that will be the advantages of ESAS regarding our students in Europe? What do you think?
Oh, well, I really love the fact that being here at the meeting now of all healthcare profession students and talking about how we want to tackle certain initiatives together, and as we were saying, publishing joint statements, joint initiatives,
Yes.
doing a stakeholder analysis on who we want to approach with our joint opinions and which changes do we want to bring forth. I think that's the next step. And having us all here and discussing and agreeing on strategies to achieve what we set out to achieve, I think that's the way to, achieve our goals.
Definitely. It will open the door for great improvement for sure.
Sure, I
Well,
hope so.
thank you, Luca, so much for your time. It was great to have you in our podcast.
Thank you so much. It was lovely of you to ask me, and
I can
really enjoyed it.
Yes, for sure. I can wait to see what EHSAA will bring to all of us. And I can wait to talk with you again, maybe in the future,
Likewise, I
with
hope
another
so.
interactions. Thank you so much.
Thank you.
Hello, Charlotte. Thank you so much for your time to be here with us for another episode of the EPSA Podcast today about the EHSAA Association and what we do. So, first of all, could you please introduce yourself and the association you represent, please?
Yes, hello everyone. So my name is Charlotte and I'm the Vice President of European Affairs in EPSA, the European Pharmaceutical Student Association.
Ah, lovely. And then could you please describe EHSAA in your own words, please?
Yes, so EHSAA is the European Healthcare Student Association Summit. Basically, it is a groupment of 5 very interesting other students' organizations.
Yes. Okay, then following that, regarding EPSA now, what do you think is our association, in this case, since I'm from EPSA as well, is working on in order to include interprofessional education and collaboration in our curricula?
Yeah, absolutely. So regarding EPSA, we work a lot in advocacy on that matter in order to collaborate and show also to our relevant stakeholders that we collaborate within EHSAA in order to bring forward some position papers or some positions that we would like to advocate at the European level. And also regarding, I would say, the more educational part, we also work a lot together in order to include public health campaign, in order to include common education. So we are working together, yeah.
Of course, lovely. And what do you think are the clear advantages of this interprofessional collaboration in healthcare for professionals and patients?
Yeah, it is clearly a big advantage, and we all need to be aware of this. We are implementing the sharing of good practices, and in EPSA, we do believe that with interprofessional collaboration, we are also better trained as pharmacy students, and we can provide a better care for our patients and in general for our work as the future healthcare workforce.
Yes, definitely. And yeah, like as different professionals, obviously we have different curricula for sure. But do you think is the differences that make us better work professionals in the future? So what are the differences that in the end allow us to better collaborate?
Yeah. I think regarding the differences, we all are coming from different backgrounds, and this is absolutely what gives us the possibility to bring our own expertise in the field. And at the end, it's the combination of all our different views and all our different curricula also that can shape a better care for our patients. And in general, we strive to take care of our patients in the best manner, and this is like our ultimate goal. And this is regarding AMR, so antimicrobial resistance, but also regarding public health issues that are needed to be solved in a group, so in more interdisciplinary vision.
No, I see you. And as you were saying, we come from different backgrounds, so everyone will be able to give a different interpretation of the situation, so that's really important. And I agree with that totally. And finally, what do you think are the advantages that EHSAA will bring to our students, the students we represent European-wise? What are the foreseeable impact that you see?
Yeah, So definitely one of the big moments also, or a big highlight that students will be able to experience also this year is the EHSAA Summer University.
Of course.
That is going to happen in August 2024. So stay tuned for this. You will have the possibility to share your common voices as the future healthcare workforce, and to use this as a common platform to stakeholders, so we could also influence to shape better policies. And it's also the opportunity to meet new people, collaborate more, and voice our common needs and our common vision.
Yeah, definitely. Well, thank you, Charlotte, so much for your time. It was lovely to talk with you, and I'm sure that our listeners are very happy with the input that you gave them about EHSAAs and also a bit about what EPSA is planning for the future. So thank you so much for your time.
Thank you so much, Susanna. And if I can just add a last point on the podcast, I think together we are stronger, and this is something we should never forget. And yeah, that was my last words.
Thank you so much. Thank you, Veronica, for joining us today to our podcast. It's lovely to have you. Could you please introduce yourself and also your association, please?
Hi everyone. Thank you for inviting me here. My name is Veronica. I'm the current president of EFSA. I come from Czech Republic, and I already work as a clinical psychologist. So EFSA stands for European Federation of Psychology Students Associations, which means that we represent psychology students from 30 member organizations that we currently have, and we also work with professionals and with other students organizations.
Lovely. So you guys really represent everybody within your field of work. That's really amazing. So now that you talked about your association, could you please describe EHSAAs in your own words, please?
EHSAAs for me is definitely a lovely network of healthcare students associations and their healthcare students and their associations.
Yes.
And it's amazing opportunity to meet with other healthcare students, to join initiatives, and also to explore the other healthcare fields.
Definitely, totally agree. So on that line, what is your association working on to include interprofessional education and collaboration? That's also one of goals of EHSAAs.
I would say that EFSA is mostly involved within EHSAAs, and its initiatives, projects, and events that we currently plan. Also, definitely, Summer University is the biggest involvement that EFSA.
Exactly. Stay tuned.
Yeah, so that EFSA contributes to, and then also other initiatives, like for example, last year we delivered some workshops together with other healthcare students, trainers. We also joined some campaigns together, but yeah, definitely the Summer University is the biggest
project.
Point.
Yes, but that's lovely. Also on that line, what are the clear advantages that you see with interprofessional collaboration in healthcare? What's your take on that one?
Definitely is the patient in the end.
I see.
And all the activities that ideally should focus on the patient. And in my opinion, healthcare is not only about each field of healthcare separately, but something that we should really collaborate on all together. And I think that the current students are the best starting point for such collaboration.
Definitely. I totally agree. Because in the end, all our work culminates with us helping our patients. And yet, each one of us have different curriculums. With us, I mean healthcare students. We have different curriculums, but there are also a couple similarities within our curriculums. Do you think those are enough to allow for this interprofessional collaboration or play even a part in it?
I definitely see some similarities that we have. At the same time, I believe that all of us could have more soft skills trainings involved in curricula, because I feel that it's something that all of us are missing. And we also try to find this extra education within our organizations, for example, all training systems, all campaigns, workshops, also the Summer University. So I think that this is absolutely something that I could imagine to learn more during my studies.
Yes, and our own associations are working in order to provide those soft skills that are lacking in our curricula.
Absolutely.
Yes, thank you so much. And then to finish, what do you think are the advantages that ESSAs will bring to our students around Europe? Come up to your mind right now.
Yeah, definitely. First of all, is the network and just the opportunity to meet with other healthcare students. I think it's definitely unique and so much needed, which is not really happening at our universities. I feel so. Just this opportunity to talk to other students to see their perspective.
Yes.
It's something that I believe we will benefit from.
Definitely, I totally agree, and we hope that actually ESSAs work in a successful way to achieve that goal, because I also believe that's really important to open the door for communication among students and among professionals. So yeah, thank you so much, Veronica, for your time. It was lovely to have you, and I definitely look forward to EPSA's improvements and work and adventures. I cannot see to wait what you guys have prepared for us in the future. And also the success that ESSAs will bring to all of us as European students in healthcare. Thank you so much.
Yeah, thank you so much for your time too. And yeah, I'm also very excited about our upcoming initiatives and activities together.
Thank you. So, are you enjoying the interview so far? For sure, I'm learning a lot about what the future might have in stock for interprofessional collaboration among healthcare professionals and the visions of students in said collaboration. But, as you might have noticed, we are not quite over yet. We still need to hear the valuable inputs from nursing and dental medicine students. So, stay tuned for that on the second episode of the podcast. We'll be doing that precisely. By the way, thank you so much for spending this time with us, and I hope to have you back here soon for another episode of the EPSA Podcast. Please do not forget to follow all the associations we have mentioned today in the description of the episode, as well as leave those 5 stars so the podcast can reach more and more people. So I'll see you next time. Bye-bye.